So in the World Health Organization, you are welcome to sit. So benefits, a new protocol ensures safety and quality of insurance. These standards align with the conventional medical requirement. Medical institutions worldwide now incorporate TCM integration occur across various specialties. So artificial intelligence enhance traditional Chinese medicine diagnosis methods. There is some machine learning algorithm identify patterns in traditional assessments. The TCM syndrome diagnosis with questionnaire for health failure, but also guide the treatment. It's standardized assessment protocol. Multi-center study included 661 chronic heart failure patients. Protocol combined traditional Chinese medicine with our modern approach. Advanced data analysis quantifying traditional Chinese medicine, and it can have some advances study involving 227 participants with various conditions. So on January of 2025, Forum United Experts worldwide, it fostered interdisciplinary pattern and machine learning optimized clinical trial design that gives some algorithm identify the ideal patient population for TCM. So new methodologies bridges Eastern and Western approach research protocol continue traditional wisdom with modern science because standardized testing ensure TCM product consistently, new analytical technique verify herbal composition, but the problem is that is 45% of patients don't discuss the use of TCM with their treating physician. That's a problem to enhance quality of diagnosis of the patients. So integration of TCM into Chinese hospital from in 2025, there is in China 47% of care patients receive TCM care. There is 92% medical school offer training in TCM and medicine, but also 62% hospital have dedicated TCM department and 78 TCM unit in university hospital. So what's the indication of TCM in intensive care units? There is pain management, preventing complication related to immobilization and supporting failing organ function. The problem is the tension between TCM with the conventional medicine about some scientific validation and practice standardization that explain the use of TCM in intensive care medicine, intensive care unit, usually. So there is some drugs used in traditional Chinese medicine with herb, it's mixture of herb that can use it in conditional use as pills, like you see. There is traditional Chinese medicine, Qixin for heart failure with reduced ejection fraction and with randomized double-blind placebo control trial that shows that there is a 50 reduction of hospitalization for heart failure from 19 to 50.6 compared when we use this kind of medication, use it in pills. It's a mixture of herb and it gives some effect to reduce the duration of hospitalization, post-hospitalization need. So this is this study done with this herb in traditional Chinese medicine. In the intensive care unit, we can use electroacupuncture. Electroacupuncture is stimulation of the needles by some vibration used by a tool that you see on my table that can give some effect with the release of endorphins, but also stimulation of the healing and the recovery of the patient in intensive care medicine. But also there is, in traditional Chinese medicine, the diagnosis with material, very performance material, to have the pulse. Because the pulse in traditional Chinese medicine, to have the experience, we need to have more 5 years to have the experience in traditional Chinese medicine. So they used to perform a material to develop the pulse by some material, experienced material with intelligence artificial. So we can have this kind of curve to have the type of traditional Chinese medicine, floating pulse, circling pulse, hollow pulse, and drumkin pulse, that gives us some indication to have a best diagnosis. So, but also there is a tools named Accugraph, improving acupuncture diagnosis in 2025. So there is a pen used on the needle's point and acupuncture point that gives some indication about the energy of the acupuncture point developed. The problem when we are experienced acupuncturists, we need to have more years to perform the diagnosis in traditional Chinese medicine by a pulse. But with this kind of tools, a pen, that give us some software to have an indication, like you see, donc with a digital measurement, with energy of each point of the meridians, but also have a visual representation to detect the imbalance, to follow and to seek the patient and the prognosis of the patient in intensive care unit. The diagnosis process, first line, we need to do initial consultations, to have the meridian testing and to report generation in the laptop, but also to pattern analysis. Like you see, it's an objective idea about every meridians, lung meridians, pericardium meridians. There is a heart meridian, small intestine, large intestine, spleen, liver, kidney, bladder, gallbladder, and stomach. When the color is green, this is a balanced energy, it's normal. When there is a red color, it's an excess of plenitude in traditional Chinese medicine, but also when it's measurement with the consistent result to have better result for the patient, for the healing of the patient, that we can use in intensive care unit, but also in other hospital. So it's important to have diagnosis. This is diagnosis in traditional Chinese medicine to help the treatment. What is the treatment? It's acupuncture. Help with the electroacupuncture to have more and the best efficiency, but also tuina. Tuina is massage. It's acupressure that we can use in intensive care with some oil, Chinese oil, to do some massage to have the same effect of acupuncture by using some courses to have the effect, to have the best healing, but also use of medicinal herb. Medicinal herb in traditional Chinese medicine help us to have best result. You see, you have acupuncture needles, but also auriculotherapy. It's the airs used in the intensive care to help patients, like you see, to have the best healing and to have the pain management, but also to have the balance of the energy. You have each projection of each organ on the ears. It's a reflexology. Before getting to the cortex, you need to have some sit. It's palm, there is on the feet, the plant, but also in the ears. The ears is easy to sterilize, but also easy to get some needles on to have the best result in intensive care medicine unit. What's the effect of acupuncture? The effect of acupuncture is to relieve from pain, the stress management, anxiety, but also to improve the sleeping. In intensive care unit, patients don't sleep because they doesn't sleep because they have some intubation, some AV access that disturb the sleeping. So we need to use this kind of medicine to help us without side effects. But also stimulation of immune system that we need in intensive care. Even we have septic shock or infection disease. So it's important to use it. Like you see, there is a tool. We can use the electrostimulation to vibrate the needles to have more effect in intensive care unit, like you see here. So the effect is used for some indication. In post-operative, we use it for paralytic ileus after surgery. That is very effective with putting some needle on some point on the abdomen, but also on the leg. Here it's Zusanli named stomach 36, but also in some points around the number, the nombril, that gives the efficacy. Even we have a patient under mechanical ventilation, but also under sedation, that help us to have to avoid the ileus, paralytic ileus after surgery. But there is some other indications, nosocomial infection. We can use acupuncture and phytotherapy for immunomodulation, but also in the intensive care unit we have muscle atrophy needed by, treated by the electroacupuncture and twina, massage twina, but also to have a best lymphatic drainage. Like you see, when we are in intensive care, we are on one seat and we don't move. We need that the nurse change the position of the patient. So when we use this kind of twina or massage, we do it on the acupuncture point, but we keep the patient in the good way to have a best recovery after discharge. But also this twina in intensive care, we can be used to treat some pain, to have a pain relief. It's very effective for the patient, but also we have a suctor. Suctor, we can use some suctor in intensive care without fire, only a suctor to have a pain relief, to detoxificate the patient, but also to avoid the thrombosis. It's very useful in intensive care to have embolisms. So there is some bed massage can we use through the traditional Chinese medicine, but also moxibustion. What is moxibustion? Moxibustion is the burn of some plant on the skin that gives some effect on the acupuncture point to have some release of some endorphins that gives effect in relieve the pain, in the pain management, very efficient. But the problem that's the smoke. Smoke in intensive care, it's not a good thing. So in China, they invent some tools because the content in the intensive care unit that with ventilation patients. So with some smoke, so they invented smokeless mini moxa that I show you. Without smoke, it's smoke, it's ticks on. This is a ticks, gives some with burning, we can burn, and with fire, and put it nearby the patients about 2 centimeters to have some heat, and that gives some stimulation. Nurses can do it easily without risk of anything. We have this kind of stick. We have also the Gugong lamp, a lamp who gives some warming that gives an effect on stagnation and to have some circulation of the blood in the body, but also the breathing. There is some kind of breathing to help patients to have calm, to be calm, but also to best healing, even in the weaning ventilation. It's very effective. Advantage of using traditional Chinese medicine is to reduce the need for conventional medication, to avoid the side effects, but also to improve the quality of life, to relieve the pain and the stress, but speeding up recovery and rehabilitation. So we have some herb used in traditional Chinese medicine that is a complementary approach with safety and effectiveness. Every time we need to put the needles in the containers, but the medicinal herb used is this kind of medicine for heart failure, but also there is an integrative medicine in Chinese intensive care. That is a paradigm shift in septic shock management. In 2025, we can use the Liang-Wan-Xin Wen. It's phytotherapy used for long COVID, but also we can develop after SARS epidemic to combat respiratory infection, officially listed to treatment of influenza infection in China, and gained wider recognition during COVID-19 pandemic. Donc we have phytotherapy that can use in common cold, season influenza, middle COVID-19, fever, persistent cough, and fatigue. This kind of administration is by capsule, traditional decoction, but also combined therapy to be used in intensive care unit, like you see. The effect of the herb is anti-inflammatory effect, improvement of microcirculation and immune modulation, to eliminate the toxin, to have lung protection, and also anti-inflammatory actions, but also cellular preservation in post-recovery time. The safety profile is guaranteed by the thousands of years of use in China, but also there is some study that document the gap, some gap in Western clinic safety data, but also dosage research, precise posology study needed. So the future perspective is to continue the research and studies, but to use this kind of medicine as a complementary therapy. But we need a global recognition all around the world. We can use it for septic shock, like an official recognition, recommended dosage and usage criteria, but also we need surveillance protocols. Like you see here is Xubigine. Xubigine is a mixed herb that was conditioned in EV access drug that can help antibiotics to have a best result in post-recovery time. So clinical evidence survey result of this Xubigine in study published in JAMA Internal Medicine in 2023, comparing the standard treatment alone that shows a reduction average length of stay in intensive care, but also organ failure scope compared to the control group. This is the indication of this Xubigine: respiratory function, brain function, to improve the kidney protection, but also to use less noradrenaline EV in continuous in intensive care unit. So there is other indication of Xubigine. It's used in other clinical disease like acute pancreatitis, acute lung lesion, but also in brain, to prevent brain injury in intensive care. The integration with conventional therapy is important because we need adjunctive therapy. The Food and Drug Administration has not evaluated Xobigine yet, regulatory difference regarding complex herbal extract pose challenges. So the potential role of Xobigine is a therapeutic opportunity, need global perspective, but there is a promising data. The problem in integrating traditional Chinese medicine in resuscitation in intensive care unit, that is a lack of recognition, but also insufficient training of acupuncturists, physicians and nurses, but there is a lack of protocols and limited research. There is almost all research are in China. So all worldwide we need to do some large studies to prove the efficiency. So I would like to show you what I did in my hospital. I use acupuncture, auriculotherapy with acupuncture on the body to help some patient polytraumatism with multiple fracture ribs, but also with hemothorax, with some broken extremities that I use with our conventional medicine. At the beginning, I start to do acupuncture. I do my resuscitation, but I use also needles and electroacupuncture, like you see for these patients that had an accident, very heavy accident, dangerous accident. He came to my hospital and I did some intubations. I took AV access, but I do some auriculotherapy, then acupuncture on the body. He was very hypoxemic, and there was a pressure. He was very low. So when I put acupuncture and my conventional medicine, that was very effective for the result, because I throw up the ventilation, the mechanical ventilation after 6 hours of and I use the conventional medicine with the traditional Chinese medicine. Like you see, his state was very positive after about 5 days of hospitalization, and I can say that I'm very happy to sit and to learn about traditional Chinese medicine, and obrigado for everything. Merci. Thank you. If you have some questions. تبارك الله عليك. الله يحفظك. الله يحفظك. على سلامتك أختي. تبارك الله عليك. If you have any questions about this kind of medicine, do you have any experience?
No, I'm a Chinese.
Chinese, yes.
So I come from Beijing.
I went to Beijing. Very beautiful.
Barcelona last year during the
Yes, I went. Yes, I was.
I heard you talk about that.
Yes.
So I was so surprised.
Thank you. I'm honored.
You use the Chinese traditional.
Chinese tradition is very effective. I use it in my practice in my hospital. This was in Barcelona.
Yeah,
I did stand.
That's why I wanted to come here. I see.
Oui.
You bought this.
Yes, I bought it from the hospital of the International Academy of Acupuncture and Moxibustion in Beijing. I bought it. It was yellow. I bought it because he was yellow. They have a yellow one because he's very old and he's very effective. That's why I bought it. For patient, this is for the number. We put it here and we do a stick on it and we let the patient, because there is some infusion and effects. This is the oil. Use it for tuna. But also there is MOX without smoke. Moxa without smoke that we can use at the hospital. But the problem with the smoke, it declenches some water, and with this we can use it by the nurses, but also by the family if they want. So there is Moxa that we can use with smoke. This is the air needle. Les aiguilles semi-permanentes that I put here on the, this is the needle, 0.30. Yes.
And so traditional therapy patient.
Yeah.
So your country allow you.
Yes, allowed us. Wait, there is no problem. Even I'm doctor. We need to be a doctor. I'm doctor. I'm anesthesiologist. I have the experience. So I sign a consent to the patient. If the patient is okay, I do acupuncture. I ask him if you want to that I do acupuncture.
You will introduce this.
Yes, I introduce every time. I ask him if you want me to do acupuncture. Everyone, and they accept. 90% accept. The 10% are afraid, but they regret after surgery, or they told me, why I have pain. I told you, I asked you if you want acupuncture, you told me no. So, but next time they propose to have acupuncture because it's very effective. I use it in post-operative, but also in intensive care unit. Yes, I do it since 2019. I use it. I did a lot of studies. I did a lot of studies with US, with United, with the, do you know Operation Smile? With the Norfolk Hospital. So they I invite some doctors from California to seek about the statistic way to be effective. And me, I'm expert in acupuncture. I show them which point use, and we did it for cleft lip, cleft palate, auriculotherapy, and some point with this kind of, do you know this stick?
Yeah, I know that. It's like a small big.
Small needle,
Yeah.
small needle, a small needle 0.6. That gives some treatment of anxiety on yin tongue, not to have anxiety. I do it for each patient, to not to be afraid of the surgery. I put it here, but also I do other things. I will show you. There is a tool that
The Moroccan Chinese.
that I bought from Beijing. I bought it from Beijing.
Oh, really? Okay.
Donc this is, I show you, because it's not.
It's morphine. I know this brand.
This is for massage, acupressure around some points on the ears. We'll try. Yes, we can try. There is some massage with music, with music of the bird singing. Operative. I put it for my patients. They are very relaxed, and they wait for the surgery time. They are very good, and I do electroacupuncture for each patient. Electroacupuncture before surgery. In post-operative, they don't have pain. So that's the.
I come from China, so I'm surprised that no any Chinese promote the Chinese traditional.
I'm Chinese. I'm Chinese by heart. yes. I'm happy. We are.
I want to come here. I said,
Because like you see, there is a Chinese flag and Moroccan flag too. That's important for me to incorporate, to have a bridge between conventional medicine and traditional medicine. That is very effective. That
do you still do that like real needle acupuncture?
Yes. I show you. I have some needles. I bought this kind of needles. This is very thin needles with some alcohol, every time alcohol. I show you. Donc this is the higu. Higu is the large intestine number 4. It's very to give, if you have a migraine, if you have some pain on the top of the body, so we need to take, it's sterilized. Donc I will show you, it's not painful.
I will tell you if you are really professional.
She will tell you. She will just, you know.
Yeah? Yes, I will tell you. Look, it's not painful. It's very thin. Then I keep it about half an hour. This is in the upper body because we need to learn about traditional Chinese medicine. There is some indications. We need to do. I will show